Many thanks for inviting me. I'm not an exemplar. I am an advocate, as Leo just said. I'm not even an employee of the NHS. So it is quite interesting. I'm providing, I hope, quite a strong patient voice based on a huge amount of experience. So the aims of my presentation this afternoon are to just outline for you the context, the drivers, and the rationale behind my doctoral research. I'm going to share with you the research conceptual model and explain how it's been put together, because I think it's really quite important. And it's about activating patients, but it's also about assisting healthcare professionals deliver patient-centered care. And then I will also outline the currently provisional 5-dimensional model of conversational leadership, emphasize this won't be complicated. Okay, I'm a pragmatist. And finally finish with a few final steps. So I'm only part way through all of this. And interestingly, I'm not an employee of the NHS. So next slide. Thanks, Hannah. If I move on to the context and drivers and rationale. 2016, I became basically a mystery shopper at UHW. Okay, I think there's another slide, Hannah. Thank you. I just thought the shopping bag would look good. Unexpected, but assaulted by a whole load of different conditions in clinical specialities, a range of inpatient, numerous outpatient, and some elements of critical care experiences and so on. And I mean, I'm quite embarrassed to say that I think on my latest count up, I am engaged as a patient with at least 13 different clinical specialities. I think that's a bit frightening, actually. But I am hugely appreciative of all the care and expertise that have helped me now lead the life that I'm living. So professionally, 30 odd years in secondary education, concluded that part of my portfolio career as a secondary head in Merthyr, then moved on to developing a leadership development business very much focused on the conversational aspects of bespoke leadership interventions, coaching, mentoring, facilitation, appreciative inquiry, action learning, hugely interested in things like CBT, NLP, transaction analysis, and so on. That led me to Ashridge and a master's degree there. And now I'm doing a professional doctorate at Cardiff Met, entitled, in effect, Conversational Leadership as a Delivery Mechanism of Patient-Centered Care. So the research rationale is, have I lost all the bits of it, Hannah? Well done, she's put them up in bits. The research rationale, as we all know, government, all the health boards, all of us as citizens across Wales, committed to transforming NHS Wales into a sustainable world-class provision that is totally inclusive and is about generating health and well-being as much as about treating ill health. And embedded within the Welsh Government A Healthier Wales policy are, of course, the prudent healthcare principles. And those principles include expressing clearly that the professionals, the healthcare professionals and the patient are equal partners through co-production. So let me just ask, rhetorical questions. What is the biggest drain on NHS resources? Actually, it's the patients. Who are the experts in managing and living with chronic illness? It's got to be the patients, isn't it? And who are best able to maintain their own health and well-being and to put on board preventative measures and lifestyle changes? The patients. So that means, next one, Hannah, thanks. Collaboration and co-production have absolutely got to be the name of the game within how we collectively move forward on our transformation of NHS Wales. So working co-productively and looking at how we do it has got to be one of the central elements underpinning that transformation. So the intention is, by shining a light on communication and leadership skills of healthcare professionals and patients, the research I'm undertaking aims to provide mechanisms for patients to increase their level of activation and quality of life. And secondly, to provide mechanisms for the health professionals in their delivery of patient-centered care. Win, win, win. So it's entitled Conversational Leadership-Based Approach for Delivering Patient-Centered Care. And there you can see the conceptual model, which you must think, why on earth you got patient engagement, activation, experience, patient-centered care? What's all that lot in there? Well, let me explain. Clearly, I've worked through an intense amount of literature review and other work linked with the doctorate. If you go on to the next slide, Hannah, please, thanks. And pulling out, and these have got a direct parallel with actually Don Berwick's much mentioned maxims. Just mention him because he's one of your international commissioners at the Bevan Commission. But Kitson et al. Are the ones who really put together the three core themes of what patient-centered care really is. The first one being patient participation involvement. Well, that actually is encapsulated by Judith Hibbard's definition of patient activation. In other words, the knowledge, the skills, and the confidence that a patient has to self-manage their health condition. The second theme flagged up from them on their huge analysis of all the literature was that patient-centered care is also about the relationship between the patient and the healthcare professionals. Now, that actually is another way of describing patient engagement at the one-to-one micro level of patient-clinician or patient-healthcare professional relationships. And the third core theme of patient-centered care is about the context and the environment where care is delivered. And that actually is the descriptor of patient experience, how a patient describes all the elements of ongoing interpersonal care they receive at different times from different people in different settings from different teams, and it describes what it feels like. And it's also, as you all know, it's one of the qualitative measures of health service quality. Thanks, Hannah. But the unknown and important star or hero here is actually, what is this thing, conversational leadership? Because I've just described why patient engagement, activation, experience pull together as being patient-centered care when broken down. But conversational leadership is something not much talked about. First, encapsulated by Carolyn Baldwin only about 10 years or so ago. Anybody who's taken part in a World Cafe might have come across it. Interesting enough, it is much used within the corporate sector, and I've not found any reference to its use within the health and social care sector. And basically, it is saying, what she says is conversation is a core process to create value. So how one works with patients and patients with healthcare professionals, conversational leadership may provide a framework that's really, really good. So where I am now in the research, there is a provisionally proposed 5-dimensional model. Please don't start thinking it's all really complex. The final information will not be complex. It will be really straightforward and understandable. It contains 5 different dimensions, one being the core conditions, which are to do with things like values and environment. So you can imagine we'll be pulling on Carl Rogers and some of his work and other people. Clear conversational structure with done to time, well aware that everything has to be time managed, as well as empathetic, as well as learning, as well as with clear actions. The leadership skills which help develop a co-created, trusted relationship within which a patient can share vulnerability is really, really important. And the leadership skills that Kaylee referred to as well earlier to do with educating, informing a patient, encouraging them, motivating them to want to self-manage their health condition. Some theoretical insight, particularly some elements of transactional analysis, can really open the doors to thinking as to what's going on for a patient at a particular time. And obviously always threading through it, as with all good coaching facilitated approaches, is the element of continuous improvement, always ending with what do we do really well in this conversation today, and what should we do next make sure we do next in our next consultation. So that's where I am with the whole research. It will turn into a simple, very clear, evidence-based model. It will be tested within Cardiff and the Vale UHB. We're in the process of finalising some additional critical reviews to define exactly how the proposed research will work. Likely to be 2 small groups of clinicians, the pilot research project, one who will be trained in conversational leadership, one group won't be. Working with new patient referrals and looking to see the impact on the patients over a period of time, and then refining. But the intention is really, really shining a light on communication leadership skills of the healthcare professionals and patients in order to help the patients move forward in levels of patient activation, and therefore enjoy, because that is the word, the self-management of the health constraints, to provide the best quality of life possible for them, and for the health professionals to be able to deliver as well as they want to be able to deliver on patient-centred care, which currently does remain slightly nebulous in terms of how you deliver it. So it might help answer that question as well. And the better all of us as patients are at managing our health, the less we will use medications prescribed, the less we will be hospitalised, the less resources we will use, and actually, much more importantly, the better health outcomes we will have. So potentially, this looking at how we talk with our patients and work together is potentially an important contribution to the whole transformational agenda of NHS Wales. So I kind of built in the next steps into that. I said that I would just outline, I forgot what the aims were, Hannah, I think that's the next one. There you go. At a pace, I have taken you through all 4 of those aims, and I just want to end by a thank you to all of you, but also to the huge numbers of staff who I've got to know and work with, and who help keep me on the straight and narrow within Cardiff and Vale University Health Board. Okay, diolch yn fawr.